Hello everyone, and welcome to this audio podcast. This audio podcast is part of an Assay edition, and this audio podcast is part of the Biomed Monster. This is an audio podcast as part of a as part of an interlude 2. And this is an audio podcast as part of an evidence base, and an audio podcast as part of another Storm Robotics production. In this audio podcast, there will be an overview in the role of point of care education, POCE, and online consultations for nephrology patients or service users through online support groups, and looking at this from a sort of critical review, so this audio podcast has has the following overview. So, in around the introduction, CKD or chronic kidney disease healthcare education provision has been in the hands of healthcare service providers, including nephrologists and specialist nurses. CKD patients are not always aware of diagnoses or armed with concepts linked to CKD, chronic kidney disease, owing to how it can become quickly multifaceted. Point of care education point of care education or POCE, and online consultations for nephrology patients through online support groups is important because service users want to be aware of disease, and so thus healthcare provision is timely, accurate, and centric accordingly. So, in around the aims, the role of point of care education or POCE, and online consultations for nephrology patients through online support groups will be contextualized, or is contextualized, highlighting reflections and contemplations surrounding eight publication outputs, and outlining sort of conclusions in around the materials and methods. The role of POCE and online consultations for nephrology patients through online support groups will be contextualized, or is contextualized, and is contextualized, and as contextualized, the publication or outputs are as thus. Yes, as thus. Number one, how young people cope with CKD, chronic kidney disease, literature review from 2012. The Lord Mayor of Bristol blood and organ donation campaign from works from 2015. 3, coping in young people with CKD, and looking at coping in young people with CKD or chronic kidney disease, original research from 2015 or 16. Number 4, service evaluation for young people in CKD, in chronic kidney disease or CKD, wherein the original sort of critical review delves into this. Within the series, the service evaluation in around young people for suffering with CKD is generally discussed throughout. Is generally discussed throughout. And number 5, is there a need for healthcare scientists and educational support surrounding CKD from peer review works from 2020. And number 6, healthcare scientists in primary care. Healthcare scientists in primary care, and looking at this works from a systematic review from 2020. Number 7, education empowerment and practice excellence, as a sort of practice review from peer review works from 2021. And 8, educational support surrounding CKD or chronic kidney disease, a qualitative inquiry a qualitative inquiry, and also where the works again was had been carried out from 2017, 2018 to 2021, and the peer review manuscript is except for sort of publication in around this year 2023, and the works looks at this from a qualitative inquiry, in around the results through this critical review. Through this critical review, there is a prompt surrounding a quality of joined up care in meeting informational educational needs and addressing health inequalities. There is still research to be carried wherein service users, and service providers, or patients and health professionals co-develop efforts internationally. In around the conclusions, often renal patients or CKD patients are not prepared or always aware of diagnoses, disease classification or disease severity, access to allied health professionals or AHPs through online space aligned to POCE or point of care education would support patients or service users surrounding quality and evidence-based practices. That draws this audio podcast to a close. This has been an audio podcast as part of an Assay edition, and audio podcast as part of an evidence base and part of as part of a biomed monster. And this is an audio podcast as part of another Storm Robotics production, and an audio podcast as part of an Assay edition and Interlude 2. Thank you for tuning in.